Overweight kids, more than 15% of adolescents in America fit in that category, a number that has tripled in the past 20 years, and the consequences can be devastating. Now, some teens are having surgery as a last resort. NBC's chief medical editor, Dr. Nancy Snyderman, has more on this. Hi, Nancy. Good morning to you.
Hi, Matt.
Before we get to the last resort, and we'll talk about that, just go over what some of the consequences of obesity are for these teenagers.
Well, I want to do that because we have a piece I really want you to see, and it really deals with just these kids, the obese children, who are really facing some very adult complications. As Matt said, are they ready for adult surgery to shed those pounds? Well, a new government study is going to look at just that in medical centers around the country. At over 255 pounds, Kylie Crovo's weight was taking a toll on her health. She was diagnosed with sleep apnea, had migraines, and was even at risk for losing her eyesight. And she was only 17 years old.
I tried Weight Watchers, low carb, low calorie, low sugar,
And when all those failed, she decided to have gastric bypass surgery, a bariatric or weight loss procedure that alters the anatomy of the digestive tract, limiting the amount of food a person can eat and digest. It has long been popular among adults, but Kylie is now one of a growing number of adolescents who have signed up.
For adolescent bariatric surgery, there's been a tremendous increase over the last few years. Since 1997, we've actually seen a 5-fold increase.
And now, a year and a half later, Kylie has lost 110 pounds.
Congratulations.
Thank you.
You're welcome. You did it.
I did. I'm happy now.
It hasn't all been easy. She's had to change the way she eats, and certain foods cause cramping. She'll also have to take vitamins for the rest of her life.
It just feels great to be able to live life not having to worry about any potential medical problems.
But some caution that the long-term effects in teens are still unknown.
And how are you doing?
Dr. Tom Inge, a weight loss surgeon at Cincinnati Children's Hospital, is for the first time studying the long-term effects of bariatric surgery in adolescents.
We really want to capture the outcomes of teenagers who are undergoing weight loss surgery, both the good outcomes as well as the risks of the surgery.
Amanda Munson is one of the participants in the study. She's lost almost 100 pounds and no longer suffers from type 2 diabetes.
The study means to me that basically I'm helping everybody else. We need to look at what this does so we can give more information to other people.
Dr. Inge and his colleagues will follow Amanda and other patients like her for at least 10 years. In the meantime, these doctors believe that for the right teenagers struggling with obesity, this surgery can help.
I think it's definitely saved my life.
Clearly, there's always risk involved with different approaches, but this is a lot like someone who's drowning. We don't wait to build them a bridge, we throw them a lifeline, and that's what this operation provides.
It talks about a lifeline, and that's in real terms, because the physical risks for a child who's obese are huge.
Huge adult problems. We're talking about high blood pressure, blocked arteries, diabetes. So doctors are saying this isn't just like you're chubby, come in, get surgery. These are huge, life-threatening illnesses in adolescence, and this is really the last resort.
Let me play devil's advocate for a second. And what about the argument that these teens are too young to have gotten to the last resort stage? That if you're 50, you've had a lifetime of trying, that perhaps in the right hands, these teens can still make a difference without resorting to surgery?
Well, that's one of the things these hospitals are going to be looking at in this study, but they would counter to say, you know what, Matt, what a luxurious idea. These kids may not get to their 50th birthday. These kids have already tried everything in the best of hands with therapists and every diet. And the concern is we are looking at a new generation of kids who, for the first time in our civilization, are not going to die because they don't have enough food. They're dying because they have too much. And we are looking at a huge crisis. How
much of this is physical concerns and how much of this is the emotional concerns of them being overweight? And we all know teens, adolescents can be cruel.
Right.
And are these children or teenagers facing this surgery or opting for this surgery simply in some ways to get out of the abuse and the teasing they get in school?
I would say no, and here's why. In order to qualify for this surgery, you have to go through a battle of psychiatric and mental and social tests. The good hospitals, like Lucille Packard Children at Stanford and Children's in Cincinnati, this is part of it. So the criteria for this, very strict. A BMI of 40 to 50 or higher, really morbidly obese kids. Serious complications like diabetes and heart disease. They've tried everything, and they commit to that psychological and social profile. And they have to have a family that's going to stand by them, because this isn't go and have the surgery and you're fine.
And quickly, staying on the emotional side, are they mentally prepared for what they're facing? Because this is life-changing surgery and behavior-changing surgery.
I can't answer for all of these kids, but it is part of that, because we know the complications are such that you never eat the same way again. You run the risk of losing some vitamins. There are significant physical issues. The psychiatric comes as part of that. But that's why there's a team approach. This isn't just surgeons. This is an entire approach around these kids.
Dr. Nancy Snyderman, nice save on me earlier.
Thank you,
Thanks very much.